Have you ever noticed something different about your body lately but brushed it off as just another part of getting older? Maybe you've been feeling more tired than usual, or you've noticed your balance isn't quite what it used to be. You might have even mentioned it to a friend who said, "Well, what do you expect at our age?" But here's the thing that I want you to understand today. Not everything that happens to our bodies as we age is normal, or something we should just accept. Your body is incredibly smart, and it's constantly sending you signals. Sometimes these signals are subtle whispers, and sometimes they're more like gentle nudges trying to get your attention. The problem is, many of us have been taught to ignore these signals or dismiss them as inevitable parts of aging. But what if I told you that some of these seemingly minor changes could be your body's way of alerting you to health issues that, if caught early, could be addressed before they become serious problems? Today, we're going to talk about 7 warning signs that too many seniors ignore, thinking they're just part of getting older. These aren't the obvious signs like chest pain or severe headaches that would send you straight to the emergency room. Instead, these are the subtle changes that creep up slowly, the ones that are easy to dismiss but shouldn't be ignored. By the end of our conversation today, you'll know exactly what to watch for and when it's time to have a conversation with your healthcare provider. I want to be clear about something right from the start. I'm not trying to scare you or make you worry about every little ache and pain. Quite the opposite, actually. Knowledge is power, and when you know what to look for, you can take control of your health in a way that can truly make a difference in your quality of life. Think of this as your early warning system, helping you catch things before they become bigger problems. Let's start with the first warning sign that far too many people dismiss, and that's persistent fatigue that just won't go away. Now, I'm not talking about feeling tired after a busy day of gardening or spending time with the grandchildren. That's perfectly normal. I'm talking about a deep, persistent tiredness that doesn't improve with rest, sleep, or even a relaxing vacation. This kind of fatigue is different from the tiredness you might feel after physical activity or a poor night's sleep. It's the kind of exhaustion that makes you feel like you're moving through molasses, where simple tasks that you used to do without thinking suddenly feel overwhelming. You might find yourself needing to sit down more often, or you might notice that you're avoiding activities you used to enjoy because you just don't have the energy. Many people dismiss this as just getting older, but persistent fatigue can be a sign of several underlying health issues. It could indicate anemia, which is quite common in older adults and often goes undiagnosed. It might be a sign of thyroid problems, heart conditions, or even diabetes. Sometimes it's related to medications you're taking, and a simple adjustment could make a world of difference. The key here is to pay attention to the pattern. If you've been feeling unusually tired for several weeks and rest isn't helping, it's worth having a conversation with your doctor. Don't let anyone, including healthcare providers, dismiss it as just part of aging. Your energy levels are an important indicator of your overall health, and you deserve to feel vibrant and energetic. The second warning sign I want you to be aware of is subtle changes in your memory or thinking patterns. Again, I'm not talking about occasionally forgetting where you put your keys or walking into a room and forgetting why you went there. We all do that, and it's completely normal at any age. What I'm concerned about are more persistent changes in your cognitive function. Maybe you're having trouble following conversations the way you used to, or you find yourself losing track of familiar routines. Perhaps you're struggling to manage tasks that used to be second nature, like balancing your checkbook or following a recipe you've made hundreds of times. You might notice that you're having difficulty finding the right words when you're speaking, or you feel confused in situations that should be familiar to you. Sometimes family members notice these changes before you do, and they might gently mention that you seem a bit different lately. The important thing to understand is that while some mild cognitive changes can be a normal part of aging, significant changes in your thinking, memory, or ability to function in daily life should never be ignored. These could be early signs of conditions like mild cognitive impairment, which can sometimes be slowed or even reversed with proper treatment. There are also many treatable conditions that can cause cognitive symptoms. Vitamin deficiencies, particularly B12 deficiency, can significantly impact your mental clarity. Depression, which is unfortunately common but often undiagnosed in older adults, can also cause memory problems and difficulty concentrating. Even something as simple as dehydration or medication side effects can affect your cognitive function. The wonderful news is that many of these conditions are treatable. Early intervention can make a tremendous difference in maintaining your cognitive health and quality of life. So if you or your loved ones notice changes in your thinking or memory, don't wait to seek help. There are many strategies and treatments available that can help you maintain your mental sharpness. Moving on to our third warning sign, let's talk about unexplained changes in your weight. This is one that many people either celebrate or worry about, but don't always recognize as a potential health signal. Whether you're losing weight without trying or gaining weight despite not changing your eating habits, both scenarios deserve attention. Unexpected weight loss is often the one that people notice first, especially if it's significant. Losing 10 pounds or more without changing your diet or exercise routine should always be investigated. While it might seem like a blessing, especially if you've been trying to lose weight, unintentional weight loss can be a sign of several serious conditions. It could indicate problems with your digestive system, making it difficult for your body to absorb nutrients properly. It might be related to an overactive thyroid, certain medications, or even stress and depression. Sometimes it's simply because your appetite has changed and you're not eating enough to maintain your weight. But this change in appetite itself might be a sign of an underlying issue. On the flip side, unexplained weight gain can also be a warning sign. If you notice that you're gaining weight despite eating the same amount and maintaining the same activity level, it could indicate problems with your thyroid, heart, or kidneys. Sometimes it's related to medications, particularly certain blood pressure medications, antidepressants, or diabetes medications. What's particularly important to watch for is rapid weight gain, especially if it's accompanied by swelling in your legs, ankles, or abdomen. This could be a sign of heart problems or kidney issues that need immediate attention. The key with weight changes is to pay attention to the pattern and timing. Keep track of your weight regularly, but don't obsess over day-to-day fluctuations. If you notice a trend over several weeks or months, that's when it's time to have a conversation with your healthcare provider. Now, let's discuss our fourth warning sign, which is changes in your sleep patterns that persist over time. Sleep naturally changes as we age, and many people find that they sleep more lightly or wake up more frequently during the night. However, significant changes in your sleep patterns can be indicators of underlying health issues. If you've always been a good sleeper but suddenly find yourself lying awake for hours, or if you're waking up multiple times during the night and can't get back to sleep, this could be more than just normal aging. Persistent insomnia can be related to anxiety, depression, pain, or other medical conditions. On the other hand, if you find yourself sleeping much more than usual, feeling the need to nap frequently during the day, or feeling unrested despite sleeping for long periods, this could also be a warning sign. Excessive sleepiness can be related to sleep apnea, which is quite common in older adults but often goes undiagnosed. Sleep apnea is particularly concerning because it doesn't just affect your sleep quality. It can also impact your heart health, blood pressure, and cognitive function. If your partner has mentioned that you snore loudly or that your breathing seems to stop and start during sleep, it's definitely worth discussing with your doctor. Changes in your sleep patterns can also be early indicators of other health issues. Sometimes medications can affect sleep, or conditions like restless leg syndrome, acid reflux, or even an overactive bladder can disrupt your sleep quality. Depression and anxiety often manifest through sleep disturbances before other symptoms become obvious. The good news is that most sleep issues are treatable. There are many strategies, from lifestyle changes to medical treatments, that can help you get the restful sleep you need. Good sleep is crucial for your overall health, immune function, and quality of life, so it's worth addressing any persistent sleep problems with your healthcare provider. As we've covered these first 4 warning signs, I want you to remember that knowledge is your best tool for maintaining your health. Your body is constantly communicating with you, and by paying attention to these subtle changes, you're taking an active role in your health and well-being. These signs we've discussed, persistent fatigue, cognitive changes, unexplained weight fluctuations, and sleep pattern changes, are all your body's way of trying to tell you something important. Now let's talk about our 5th warning sign, which is something that many people experience but rarely connect to their overall health: frequent digestive issues that seem to come and go. You might think that occasional heartburn, Changes in your bowel habits or stomach discomfort are just minor inconveniences, but your digestive system is actually one of your body's most important communication networks. If you've noticed that you're experiencing more frequent heartburn, especially if it's happening when you're lying down or if it's accompanied by difficulty swallowing, this could be more than just eating too much spicy food. Persistent heartburn can sometimes indicate gastroesophageal reflux disease, which can lead to more serious complications if left untreated. It can also sometimes be a sign of other digestive issues that need attention. Changes in your bowel habits are another important signal that many people feel embarrassed to discuss, but they're actually very important indicators of your digestive health. If you notice that you're becoming more constipated than usual, or if you're experiencing more frequent loose stools, especially if this pattern persists for several weeks, it's worth investigating. Constipation can be related to medications, dehydration, lack of fiber in your diet, or reduced physical activity. But it can also be a sign of more serious conditions. On the other hand, persistent diarrhea or loose stools can indicate problems with nutrient absorption, infections, or other digestive issues that need attention. What's particularly important to watch for is any significant change from your normal pattern. If you've always been regular and suddenly you're not, or if you notice blood in your stool, changes in color or consistency, or if you're experiencing persistent abdominal pain, these are all signals that your body is trying to tell you something important. Your digestive system also plays a crucial role in your immune function and overall health. Problems with digestion can affect your energy levels, your mood, and even your cognitive function. Sometimes what seems like a minor digestive issue can actually be impacting your entire well-being. The good news is that many digestive issues are very treatable. Sometimes simple dietary changes, increased water intake, or adjustments to medications can make a significant difference. Other times, you might need specific treatments, but the key is not to suffer in silence or assume that digestive problems are just part of getting older. Moving on to our sixth warning sign, let's discuss changes in your balance or coordination that you might have noticed creeping up gradually. Balance problems are often dismissed as an inevitable part of aging, but they can actually be early indicators of several different health conditions that are worth investigating. You might have noticed that you feel a bit unsteady when you first stand up, or maybe you found yourself reaching for the wall or furniture more often when you're walking. Perhaps you've had a few close calls where you felt like you might fall, or you've actually had some minor falls that you attributed to clumsiness or not paying attention. Balance problems can be related to several different systems in your body. Sometimes they're related to your inner ear, which plays a crucial role in maintaining your sense of balance. Conditions like benign positional vertigo are quite common in older adults and can cause dizziness and balance problems, but they're also very treatable. Changes in your vision can also affect your balance, even if the changes are subtle enough that you haven't noticed them yet. Sometimes balance problems are related to blood pressure changes, particularly if you feel dizzy when you stand up quickly. This could indicate that your blood pressure is dropping too much when you change positions, which can be related to dehydration, medications, or other health conditions. Balance problems can also be early signs of neurological conditions, problems with your muscles or joints, or even side effects from medications. The important thing to understand is that balance problems significantly increase your risk of falls, which can have serious consequences for your health and independence. What I want you to know is that balance problems are not something you have to just accept and live with. There are many effective treatments available, from simple exercises that you can do at home to physical therapy programs specifically designed to improve balance and reduce fall risk. Sometimes addressing underlying conditions like blood pressure issues or vision problems can significantly improve your balance. If you've noticed changes in your balance or coordination, don't wait for a fall to happen before you address it. Talk to your healthcare provider about what you've noticed. There are also balance assessments that can help identify specific areas of concern and guide appropriate treatment. Now, let's discuss our seventh and final warning sign, which is persistent changes in your mood or emotional well-being that seem to go beyond normal ups and downs. This is one that many people, especially those in older generations, tend to dismiss or feel reluctant to discuss. But your emotional health is just as important as your physical health. Depression and anxiety are not normal parts of aging, despite what many people believe. If you've been feeling sad, hopeless, or anxious for several weeks, or if you've lost interest in activities that you used to enjoy, these could be signs of depression. Sometimes depression in older adults doesn't look like the sadness that people typically associate with the condition. You might notice that you're more irritable than usual, or you might feel a sense of emptiness or numbness rather than sadness. Sometimes depression manifests as increased worry about your health, your finances, or your family. You might find yourself avoiding social situations or activities that you used to look forward to. Anxiety can also develop or worsen as we age, sometimes in response to health concerns, life changes, or losses. You might notice that you're worrying more than usual about things that previously didn't bother you, or you might experience physical symptoms like restlessness, difficulty sleeping, or feeling on edge. What's particularly important to understand is that depression and anxiety can also cause or worsen physical symptoms. They can affect your sleep, your appetite, your energy levels, and even your immune function. Sometimes what seems like a purely physical problem actually has an emotional component that needs to be addressed. The stigma around mental health issues, especially in older adults, can prevent people from seeking help. But depression and anxiety are medical conditions, just like diabetes or high blood pressure, and they respond well to treatment. There are many effective therapies available, from counseling and support groups to medications when appropriate. Social isolation can also significantly impact your emotional well-being. If you've experienced losses of friends or family members, or if mobility issues have made it harder for you to maintain social connections, this can affect your mood and overall health. Humans are social creatures, and maintaining connections with others is crucial for our well-being. The key is to pay attention to changes in your mood or emotional state that persist for more than a few weeks. If you're not feeling like yourself, if you're not enjoying things that used to bring you pleasure, or if you're experiencing persistent worry or sadness, these are signals that deserve attention. As we wrap up our discussion of these 7 warning signs, I want you to remember that you are the expert on your own body. You know what's normal for you and what feels different. Trust your instincts and don't let anyone dismiss your concerns by saying it's just part of getting older. These warning signs we've discussed today: persistent fatigue, cognitive changes, unexplained weight fluctuations, sleep pattern changes, digestive issues, balance problems, and mood changes are all ways that your body communicates with you. By paying attention to these signals and taking action when you notice changes, you're taking control of your health in a powerful way. Remember, early detection and intervention can make a tremendous difference in your health outcomes and quality of life. Many of the conditions that can cause these symptoms are very treatable, especially when caught early. Don't wait for symptoms to become severe before you seek help. I also want to emphasize the importance of having a healthcare provider who takes your concerns seriously and partners with you in your health journey. If you feel like your concerns are being dismissed, don't hesitate to seek a second opinion or find a provider who will listen to you and work with you to address your health concerns. Your health is your most valuable asset, and you deserve to feel your best at every stage of life. Small changes in how you pay attention to your body and advocate for your health can make a big difference in your overall well-being and quality of life. I'd love to hear from you in the comments below. Have you experienced any of these warning signs? What steps have you taken to address them? Your experiences could help other viewers who might be going through similar situations. If you found this information helpful, please give this video a thumbs up and consider subscribing to our Wise and Well channel. We're committed to providing you with practical, empowering information to help you live your healthiest, most vibrant life at any age. Remember, you're not just getting older, you're getting wiser, and that wisdom includes knowing when to pay attention to what your body is telling you. Here's to taking charge of your health and living your best life, today and every day.